calling the meeting to order, and I'm going to let Chris take the lead, I think, on it. Is that appropriate, Chris?
Sure.
Okay.
Yeah.
Because it's the data notebook.
Yes. I haven't been to one of these meetings, so I wasn't sure how that would work. All right. So, the data notebook this year, we wanted to review what was provided to us from the state, the data, and be able to review that data and be able to answer the questions that need to be answered. And we included the section managers to be able to answer questions within their sections as they come up for you. So as you see the data that's being presented from the state, you can ask questions and clarification from the section managers. So Sid is here, and so is Wendy. So Sid for acute and forensics, Wendy for adults, Karen for youth. Susan Castillo is also here to help with this data notebook process because she's done it before. And she is our DEI manager. So let's go ahead and get started. Tori, I do think it would be helpful to bring it up. Did everybody receive the handout that Tori emailed?
Yes.
Yeah.
Okay. Great. All right. So should we dive right into the looking at the data? Have you all had a chance to kind of look at the background and the purpose of the data notebook?
Could I ask for a review for clarification on what access versus engagement rates are, what data is used to determine those individually?
I think on the slides, how they're determining, and correct me if I'm wrong, is access is 1 visit and engagement is, I think it says 5 or more. So that's how the data is defined, access versus engagement, if that's your question.
Thank you.
I have a question.
Mm-hmm.
Are we starting with part 2 or are we going to do part 1?
Can we just go from top to bottom?
We can just start from the beginning, sure.
Okay.
So I think the first 5 pages are background, that this is something that's being done in every county, and the results will be sent to the state and, well, the organization doing it, and it'll all be put together. And I think the questions start on page 6, and probably we can just go to there. We're looking at adult residential care and foster youth, I believe, focus, and then race and ethnicity.
Okay, so yeah, part 1. Do you want me to go ahead, Kathy?
Yes, I do.
Yes. So part 1 of the survey is include these questions. So identify your county, how many individuals did your county behavioral health department pay some or all of the costs to adult residential care facilities? What is the total number of adult residential care facility bed days? How many individuals were served in your county department that needed this type of housing but are not living in an ARF? Do you have any institutions for mental disease, IMDs? Yes or no? For how many individual clients did your county behavioral health department pay the costs for an IMD stay, if they were in county or out of county? And then what is the total number of IMD bed days paid for these individuals by your county behavioral health department during the same time period?
So
And
I believe that that most of those are filled out on the draft Survey Monkey. And so I don't know, either Tori or I've got the printout of, I think, what Tori had put together for the draft, and those questions are answered. So either if people want to know what the answers are, you know, I could just read them off of, I printed out the draft. There are some that weren't answered that we probably need to look at. So do people want to know what the answers are to those questions?
I would, you know, briefly, if we go through and just read off whatever the essentially numbers are, and then identifying which things have not been determined yet.
Okay, so for number 2, there were 262 individuals that we paid for some or all of the costs to reside in a licensed adult residential facility. There were 74,252 bed days paid for those individuals. The comment on number 4 is that we're unable to estimate numbers that would require an adult residential facility level of care. Approximately 47% of the adults who were assessed for behavioral health services in fiscal year 18-19 had problems with maintaining residential stability, which is characterized by homelessness, living on the streets, in shelters, or other forms of transitional housing. We have approximately 250 individuals who had contact with behavioral health services each month who are homeless, with 595 total individuals reporting homelessness during that year. And then we do have one IMD. And
Is that Aurora?
no, it's
It's Creekside Behavioral Health.
Okay.
It was not filled in how many individual clients our county paid for an IMD stay in or out of the county.
Requested that again from our fiscal department. So I will make sure it is added in there for the first.
Or I can get you that data set.
Thank you.
We have it in Avatar.
Awesome. Thank you.
The total number of IMD beds paid was 5,208, but we don't know how many individual clients there were in and out of county.
we have a request to share these numbers as opposed to only reading them off. Tori, are you able to share the question and answers on the screen?
Are you not seeing them? I have it here.
We can see the questions, but not the answers.
So you can't see right in here? It's
No, there's no answers on them.
really.
I mean, there's another, the draft that you sent out, and I don't remember where I printed it from, but the draft had the little boxes with the numbers, and that's what I'm reading off of.
Okay. I reshared it.
Yeah,
Thank
that one.
you.
That's
Thank
it.
you.
Okay, sorry about that.
No problem. Thanks.
Perfect. So we're on the next page. Oh, no. Yeah. We're on page 7.
And sorry, just so that we're all on the same page. So when we counted adult residential facilities, we were counting board and cares as well as social rehab programs and in and out of county. Was that right, Corey? I can't hear, we can't hear you.
Sorry. I requested exactly what the question was from fiscal, the Avatar people to help me get that. So this,
If that's the case, I request that I rerun that number.
that'd be fabulous.
Yeah, and I don't know what they're saying they want. If they really just want adult residential facilities, it's a different category than the social rehab facilities. So I'm just wondering what they're actually looking for here, because we do have different kinds of facilities that we place people in.
Would it be useful just to give them an answer, which is a breakdown of the various facilities?
Well, if it would allow that to be typed in.
Are defining it in the instruction as people residing in licensed facilities on the CCL. So that would include both the board and cares and the social rehabs, because they're classified as ARFs, both of them, in that nomenclature. So said I can rerun it with those two.
Okay.
Thank you, Wendy.
Mary Frances Walsh asked in the chat if Aurora, which apparently has been renamed, is it not also an IMD?
So I'm responding in the chat. It's so Santa Rosa Behavioral Healthcare Hospital is the new name, and it's technically an IMD by federal definition of an Institute for Mental Disease, but it's not in terms of this data notebook. They're looking for folks who are getting long-term placement in conservatives in a locked facility, and so Santa Rosa Behavioral Healthcare Hospital is an acute psychiatric facility. And that's not what they're trying to capture here. I hope that makes sense.
Thanks.
Okay, so we can scroll down to where we left off. Was this the next question, Kathy?
Yes. So new programs implemented or existing programs expanded. Does that look accurate to everybody?
Does anyone want an explanation for what these are? So if this is for fiscal year 2021, what new programs were implemented? We said an emergency shelter was implemented or expanded.
I guess my question is, a lot of these weren't implemented in our county behavioral health department, but they were implemented in our county. And I think rapid rehousing and transitional housing were also implemented in our county, but not necessarily for behavioral health clients. They were for, for folks who were being contacted by IMDT and HART and stuff like that, I think.
So the instruction here is in your county behavioral health department to serve, right? So I would imagine, and if you look at the universe of the planning council, it's for the universe of the mental health plan and the mental health board. So I think it's really it's not for the entire county. It's
right.
Just for the behavioral health department.
Right. I'm just not sure how we answered this question given that, because it seems like none of these were specifically for our population.
Correct.
So maybe in other you could say that the above were expanded within the county, but not by the behavioral health department itself.
Well, and not exclusively for our populations, right? So that's the issue, right? They want to see if the people in the mental health plan are getting these kinds of services, right? So so that would be the question, right?
Did they have access to these things?
Not
Yeah,
exclusively. So, right. So it's not exclusive to beneficiaries of our behavioral health services, but they could be included in the group that
So-
received.
So in the other, that box is the only place we can put a comment, I think. So they were expanded in the county, but not by behavioral health. And the services were not exclusive to behavioral health clients.
That makes sense.
Okay, that should,
So I think so, if you just go back to the purpose of this document, right? So and on some level, it's 6 of one, half dozen of another, right? Because the mono county, for example, right, they have, everybody's getting whatever service that they have. So if you, as you guys are answering these questions as a mental health board, do you think that these openings of these, I mean, even though they're asking this question specifically, it really is about the spirit of the question, right? Do you as the mental health board feel satisfied that we have these programs that are relevant to our, so I'm saying something different than I originally said, that are relevant to our population, right? Because we're a small, it's not like we're LA County and can open, if we're going to open something, it has to sometimes, to get paid for, has to be for more people than we can offer. So the idea is, do you feel like as a mental health board that we have enough? So as you think about when you answer this question and then moving forward, what that your answer to this question means as you move forward answering other questions. Does that confuse everything?
well,
My sense is that these programs swept up all the wide spectrum of those in need, including folks who needed mental health services specifically, but they were not excluded from these programs that were countywide.
yeah, so I think the other, for me, the little explanation down there explains our answers.
Just for clarity, do we want to put an X in the other category? I don't know.
Probably.
I'll get that added before this
Okay,
is the draft. I actually enter the information into the actual survey. I'll make sure that that is checked.
okay. Okay, I know that what's coming up is big, so let's just leave that like that is. Okay, let's look at this. That's something that I think we have to look to Karen, because I don't know enough about it. I mean, I can believe a yes answer and the explanation, but
Yeah,
Uh,
I'm happy to answer any questions that anyone may have.
I think as just a general statement and connecting to what was brought up in the last slide, and this is kind of a pessimistic response, but when we're getting to questions like, do you think your county is doing enough to serve the children and youth in group care? My automatic answer is no matter how much the county is doing, it's not enough, and we should keep striving to do more, which again is pessimistic. But and that's nothing to do with county efforts or people's efforts and work. It's just to do with, like, there's financial limitations, like, and of course we should always have more facilities and alternatives for children and youth groups. So yeah, that's kind of my take on that. I'm not saying we have to go with no, but that is my thought.
I had the same thought, so I'll just second that thought there. I was thinking the same thing.
My question to that would be, how do you define enough? Enough is really a big word to be in that question.
Yeah, I would agree with all of you on that. I mean, I think there is there's validity in saying that we can never do enough to serve children who are in group homes, regardless of how much we're doing. And of course, systems like ours never have enough funding and resources to do as much as we would like to do. So from that perspective, no, I don't know that I could ever say we're doing enough from that perspective. I do think that we are adequately serving children who are in group homes here in our county. We're providing them all of the services that we have available and that we can. I think we definitely could be doing more to get them out of group homes, which is why we're looking into implementing therapeutic foster care. So I guess to your point about how we define enough, I could go with either answer, really, just depending on what our perspective is on what that question is actually asking. I don't think that we're not doing our jobs or underperforming, but I also agree that there's always more we could do.
Yeah, that's why I think, there's a difference between adequate and enough. Yeah, are we serving them adequately? Most likely, but enough is, very cognitive.
Well, the fact that we're starting conversations with child welfare means that we're acknowledging that, no, we need to, expand a little that way. So I'd be comfortable changing it to no.
Are there any other recommendations or from the mental health board around doing more for children or youth in group care? Therapeutic foster care is one of the services that's being proposed.
Well, I think what Karen had said as far as the viewpoint that we are providing adequate care might be, we're providing adequate care, but looking at additional options might be integrated into that responsive sentence there.
Yeah, that sounds good.
That makes sense.
Put in that we are providing adequate care at the beginning of that sentence.
Right.
Yes. That look good?
Mm-hmm.
Okay. On to 10. There's a question. How many?
So I can answer that question for fiscal year 2021. We have gotten 41 children from other counties into this county in fiscal year 2021.
Okay. Okay, and have we placed kids in another county?
And that number is 42.
Okay,
Can you give me a sense, a rationale, aside from the fact those numbers are almost identical, why some from outside? Is it a matter of timing, the need, or what? The same number are coming in as going out, essentially.
Yeah, it is kind of funny that it's the same. I think that's a coincidence mostly. And it has to do with a number of factors. Which residential placement has a bed available at the time that we're looking for one, for example, for a Sonoma County kid. Does the kid need a placement that has a specific focus or treatment expertise? And does that exist here, or does it exist in another county? You know, I think all the counties across the state are kind of competing for these beds. Our preference would always be to have them locally rather than sending Sonoma County kids out to other placements. So that's always our first effort, but there aren't always beds available locally, and then we will start to look elsewhere. And we do have frequent conversations with our local providers about the fact that we would really like for them to serve Sonoma County kids. So we're really trying to emphasize to them how important that is to us. There are a couple providers interested in looking at developing more local options, including Human Services, which is looking at opening up an STRTP locally. So we're hopeful that in the future we'll have more local beds, and that we can also really encourage our providers to take local kids as much as possible. And of course, for kids coming in out of county, there are counties that don't have any beds locally, so they have to place out of county.
Is that like a normal problem for entire counties not to have any beds?
Yeah, I don't know the numbers on that, but I know that it's not, it's not just one or two. There are counties that don't have any local beds. Probably it's mostly smaller counties that just don't have a provider locally who has the interest and willingness and ability and resources to open up a residential placement.
okay, so these are the ones where we have to look at that data.
With the charts that were provided.
Which is a little difficult to do side by side.
Were you just talking to us, Chris?
I was. I was totally muted. But Tori was doing what I was asking her to do. That's weird.
Gesturing while you were talking.
That's a little creepy. Okay. So what I was saying was on the document that I had Alex clean up for us to make it a little easier to see, at the very end are the questions just very simply put. So this is the first question. So based on the data provided for your county, please rate the access and engagement to step-down services for each of the following groups. So if we go, and then it goes through the different groups, and you have to rate excellent, very good, good, fair, or poor. So can we go back up to the data, to the chart, the first side-by-side grid? Is this the first grid that they show us? Yes. All right. So the left is Sonoma County and the right is the state of California. And I know it's a little small. There we go. So you can see in Sonoma, white Caucasian is the highest population served by race, 63.1% total. For the state of California, it is Latino, Latina. Total population 38.8%. Caucasian is 37.2. And Latino, Latina for Sonoma County is total 28.2%. So there's that main difference. Go ahead.
So the total population, does that mean that in Sonoma County, 63.1% of the population is white?
That is a good question.
No, I believe that's about who's getting mental health services.
Yeah, because then it's broken down by FSP, which is the full service partnership.
Uh-huh.
And then CSI. Is there an explanation about the CSI? Let me look at my document. CSI, persons receiving publicly funded mental health services as reported in the CSI system.
But then that would be our population
Yeah,
receiving mental health services. Maybe it is the total population.
it compares the percentage of total persons by race and ethnicity in your county and California from 3 sources. So total population is the Department of Finance population estimates based on the US Census data.
Okay.
CSI is persons receiving publicly funded mental health services as reported in the CSI system. And then the FSP are persons in full service partnerships.
So because we have so many unknown, that's skewing that's probably
Yeah.
making our numbers a little hard to understand.
Unknown for the state. It looks like the state unknown is a little bit higher than our unknown, which is interesting.
That is.
The state's unknown is almost 15% for FSP and 11% for CSI. Ours is 13.3 and 8.5. I mean, the major difference I see is the Caucasian versus Latino, Latina difference between Sonoma and the state. And also Black African American is higher in these for population served. %. Oh no, I'm sorry, 1.9% in Sonoma County, the total population. Whereas in the state of California, 6%. So when you look at this data,
I have a question on the Black population. Is it African American or just Black? Because these are different.
It's looks like it combines both. So Black/African American is one category.
Okay, which skews the data. Every Black is not African.
So the question is, based on the data provided for your county, please rate the access and engagement to step-down services for each of the following racial ethnic groups. So
what are they meaning by step-down services? I can't figure out what the definition for that is.
I'm just looking if there's more of a definition.
I'm almost thinking with the way a lot of these questions are either described or asked, we might do well to get involved in the creation of the state notebook in future years rather than simply trying to fill it out.
Are you volunteering, Bob?
Possibly not.
Well, Bob, I have a lot of, having done this for many years, I have a lot of feedback, which I think would be really helpful for mental health boards about how they might go. And I've talked to Kathy about this and others about how they might go about asking these questions and how they might go about structuring the process. I think there's room for improvement that would be really instructive.
I think there's a spot at the very end to give suggestions. And we can put you in there, Bob.
Yeah. For further information, call Bob Cobb.
Yeah. Okay, so we're supposed to be we're supposed to be saying we're doing a really good job or we're doing a bad job, right? That's the scale.
So, correct. And if we actually go to the next data set, it does give us a breakdown of access and engagement. So the first data set we looked at was access by race and ethnicity. The next data set, Medi-Cal mental health access and engagement rates by race and ethnicity for 1920. So the one that we just looked at was 17, 18, 18, 19. And if we, Tori, if you scroll down, this is showing us the mental health access rates and engagement rates for 1920. So this first data set is access rates. And there isn't a definition that I could see in the data notebook for the difference between access and engagement. Susan, I think you said it had to do with initial service versus like 5 or more services.
Yeah, I read something in one of those.
Yeah. So for Sonoma County, the orange line is mental health services. The blue line is specialty mental health services. And this is access rates. So the Medi-Cal, what this tells me is that the Medi-Cal population in Sonoma County accesses the managed care plan at a higher rate than they access the mental health plan. They're getting, right? Are you all interpreting this the same way, that they're getting services, they're accessing partnership health plan at a higher rate than they're accessing Sonoma County behavioral health? That's what I'm seeing in this. So 21% of Alaska Native American Indian are getting access to partnership, and 2.2% are getting access to Sonoma County behavioral health, and so on for each race. So it looks like unknown, 5.2%. So our highest access rate for Sonoma County behavioral health is 5.2%, and it's an unknown population. 4.9% is considered a Black population. And the next up is white at 3.1%, other at 2.9%, Alaska Native American Indian at 2.2%, Asian or Pacific Islander 1.3%, and Hispanic is 0.9%. And that's accessing care.
Of the total population of those different categories in Sonoma County.
Correct. Yep. If you want to compare that to the state, scroll to the right. In the state of California, managed care plan is accessed more as well. And in the state of California, it looks like Black is the highest percentage, 7.6%.
That's why I was smiling. I was like, whoa, what's the difference?
Mhm.
For being the lowest category in the state, and access 11.3%.
Mhm.
That's telling.
Alaska Native American Indian is next on that, 6.1%. Followed by white, followed by unknown, followed by other, Hispanic 2.5, Asian Pacific Islander 1.9.
Would you repeat how you're interpreting specialty mental health services versus mental health services?
Yes, the blue line is specialty mental health services, and the orange line is mental health services.
Right, but what do those categories include or exclude?
In my mind, I think it's, I'm interpreting this as someone has mild to moderate need and they go through their managed care plan, partnership, health plan in Sonoma County. And I know there's others in the state of California. So they're getting their therapy through their managed care plan, for example, as opposed to coming to the county for specialty mental health services, which would include more intensive services.
Okay, so basically county behavioral health services are the specialty.
Correct.
Mental health. Okay, got it. Thank you.
Okay,
Chris,
so this,
could we back up a bit to page 12?
Sure.
Just as we're considering this. Okay, if you scroll to the left, Tori, to right on that same latitude where you are, the table, the charts on the bottom, the tables. So here's the issue I'm seeing in terms of interpreting this data set. You look at the total population statistic on the bottom row, they're saying that's the percentage of population in Sonoma County that is identifying as that ethnicity. And then you would use that as the basis of comparison for the other numbers. The problem is that the overall percentages of population in the county isn't the same thing as the Medi-Cal population in the county.
Right.
And so while what this would say is that we're actually serving more people who identify as Native American percentage-wise than the county population statistic, we're over-serving that group. We're underserving Asians and Pacific Islanders. We're over-serving Black and African American relative to the overall population statistics. We're underserving Latinx. We're underserving white and Caucasian, and so forth. Per this, the problem with this is that as a mental health plan, our population is Medi-Cal beneficiaries, and that has a very different composition than the numbers we're looking at here. I can tell you that the current, for instance, percentage for Latinx in the Medi-Cal population is 42%. So we're actually massively underserving that population relative to our base.
Yeah.
And so I just want to point that out because as we're trying to interpret this, just please bear in mind, this is talking total population statistics, and that's not actually our client base. And so if we're going to interpret need based on this, we need to take that into account because this number set says that we're underserving Latinx, but not by that much, when in fact, we're actually probably roughly half where we should be. And so based on more current data than this. So we need to take that into account when we're looking at this.
And that would also be really good feedback for this, for the people putting this together, because it's really kind of apples and oranges. And if people are looking at this thinking that they're comparing them apples to apples, it's not right.
Yeah, we might look at this and mistakenly think we're doing fine in certain categories, but we're not. And so that's of concern. I know they pull some of this from the eCuro data sets. Those data sets actually do report on the Medi-Cal population. And so I'm a little confused as to why we're seeing it based against the total population statistic instead of that. But for what that's worth, you know, that's the other reason why you're seeing such disparity between us and the statewide averages, because the statewide population statistics are very different than the Sonoma County ones. If you scroll to the right, Tori, you know, the percentage of clients that are identifying as Asian and Pacific Islander, for instance, across the state versus in Sonoma County is vastly different. So across the state, it's massively underserved is what we're seeing here. Whereas in our county, it looks a little bit different. So it just want to call people's attention to that bottom row is the basis of comparison by which you would gauge the other numbers, as opposed to comparing, well, our percentage is lower than their percentage. It's really, we need to look at the difference between them. How far off are we from the base number relative to how far off are they to the base number? And then if you scroll down back to where you were, Tori, in the next set of slides here, yes. Again, what we really need to compare this to is the Medi-Cal population statistics to make meaning of this. We would expect to see a lower percentage of numbers in the specialty mental health services because there is less need for that than regular mental health services. So you should see the lines looking this way. There should be longer orange lines than blue lines. But without the frame of reference on how this maps to the Medi-Cal population, it's hard to gauge where the issues are.
Okay, so is there really a way then to answer number 12, given this data?
I think that we can safely conclude, based on both ours and the state data and what we know of our Medi-Cal population, that we do have issues serving our Latinx population. I think that we can safely conclude that because we know that to be the case. It'll be harder for us to make the same determinations with the other groups.
I have a question for you, Wendy. You were saying that we underserve the Latinx community based on that data. And if it's based on that data, why can't we use that same data to see whether we are underserving other communities?
Sorry, let me clarify. Based on our knowledge of the actual Medi-Cal population statistics, that 42% of that population is Latinx, and we're only serving 27% in the mental health plan. We can probably safely conclude there's an issue there. I would need to pull that actual data set for the other groups to know on the other ones.
Yeah, I just wanted to know, I wasn't questioning whether you were correct. I was just wanted to know what data set you were using to make that comparison, because if you're looking at this one, then it screws everything up.
Yeah, I mean, we could pull up the most recent EQRO data set that looks at this based on the Medi-Cal population.
Okay, thank you.
I'm curious, what can you show or indicate what are the options there to respond to? I don't know what those drop-down menus might show that we're looking at the moment. Can you click on one of the blocks that has a drop-down menu?
I was muted again.
Oh.
It ranges from excellent, very good, good, fair, or poor. So there's 5 choices, excellent to poor.
Thank you.
Mhm.
Ugh. Not enough information.
And if you scroll up slightly, I think it says to respond based on the data, the first line, based on the data provided for your county. So our hands are somewhat tied by that, it seems.
Yes, I'm a little puzzled as to how the data provided for our county would actually answer this question.
So would the board like to answer in this category that we would need more information in order to accurately answer this question? The data provided is, you know, not sufficient, something along those lines.
Is there is there a way to write that in? I don't see a block to write.
Yeah, it doesn't look like it.
I think that we could maybe write at on number 27. There's a feedback box that we could. I've been just writing on paper that you know, we know that that Medi-Cal data exists. Yeah, that box.
No, Chris, if it's helpful, I did find the more recent data table in our EQR report. I can grab an image of that, send it to Tori, or I can show it if you want.
Oh, why don't you go ahead and show it?
Yeah.
Zoom in so it'll actually be visible here. Oops. Or if you would enable me to be able to share. Here we go. Thank you. Okay, here we go. Let me know if that's large enough. Is that good?
Yeah, I think we can see it.
You see that pretty well? Okay. So this is what was provided in our most recent report that we just got this year. And so this data set is 2019, calendar year 2019, which is a little more current than the 17-18 data set we were looking at. And this is actually Medi-Cal beneficiaries in Sonoma County. And then by percentage, you can see the percentage, and our Latinx population is the largest group here. This is who we're serving in the mental health plan and by percentage. So if you want to compare these two percentages, you'll see where we're overserving or underserving various groups relative to our Medi-Cal population. So by this data set, we are underserving by a fair amount our Latinx population, and we are underserving our Asian Pacific Islander population. We're about on par for Native American. We have a large number of people in the other category. So that gives you a better picture of what's going on. That might help us answer some of the questions on how well we're doing with engagement.
So
I think this is relevant, yeah.
Yeah, we have to address these categories. So while we're looking at this, we could say that the white population, it looks like we are, so the categories were from excellent to poor, right? So the white population, it looks like we're doing fine. That looks, we could probably say excellent. Yes?
Yeah.
Sure.
Okay. And this is access?
This is services, so it's.
This is more like engagement. Okay, and Hispanic, we're not doing so hot, so that could be poor.
We're doing poorly. That's so hard.
Black. Well, it's African American here. Sorry, Peterson.
It's not speaking to me.
It looks like given our population that we're doing okay there. So would you say excellent or
I would say good.
good? Okay. And Asian Pacific Islander, it looks like we are underserving them, right?
Yeah,
Mhm.
yeah, most
So-
definitely.
By almost half.
So is that poor?
We'll see, Paul. I mean, when you're serving less than about half of the population, that's really not
And
reaching the
Native
whole.
American, we're right about even.
Mhm.
Is there an adequate level? There's
There's-
something in the middle.
Yeah, there is. So it's excellent, very good,
Um,
good, good's in the middle, poor, I'm sorry, fair, and then poor.
And Paul.
So Alaskan Native American is probably good,
Mhm.
and Black was a little bit higher. What was the one that was just above good?
Very good. So good, very good, and then excellent.
Would you be okay with very good, Peterson?
Oh yeah, I'm fine with that.
Okay, so that's engagement. Do you have a similar chart that gives us access?
I think I can get that. Keep talking and I will work some magic in the background.
Is there some way that we can reference our answers to that particular table? And
Tori,
because we
I'm
are
going to
not
grab it
asking-
and email
yeah.
it to you. Okay.
Okay, well, I just meant in as far as our reporting, because they're asking us to use the data that was provided, and that is not relevant to our answers.
We
Yeah,
can
I think we can reference the most current eCuro report. It is a
Yeah,
public document.
We should reference the most current one, so at least you know where you're coming from.
So I think that can be put in the feedback at the end, because I don't see a spot to write it right there. But there's a feedback section at the end, the very last thing that I think is unlimited in how much you can put in.
And also in the feedback, we might say after each question, have a block where additional comments can be added instead of everything piling up at the end.
Okay.
And then Tori, if you want to add for question number 12, we used the 1920 EQRO data.
We want to explain because it was more accurate to answer this question, that the data they provided us with
I think that's more
wasn't
recent.
helpful.
And relevant, really.
You can even put, it was used to answer the questions as it was more relevant and helpful. And then are those notes to you, Tori, to then fill out those boxes with the scores? You're muted.
Yeah, I know, I'm trying to find my button, sorry. Yes, so.
Okay, sounds good.
Yeah, I'm making notes and then I'll go up and when I do the drop.
Perfect. Okay.
So Tori, I'm just going to type into the chat the notes that I took as we were discussing that section, and then you can pull from that too. Okay.
Thumbs up. All right, we have about a half hour left, so let's keep moving. Are we ready to move on to 13? Question 13 is what outreach community engagement and or education methods are being used to reach and serve the following racial ethnic groups in your community, and select all that apply. So Tori, I think you're going to have to scroll up so we can see that question and all the options. All right. And this is not related to looking at any data. I think this is a matter of talking with the section managers and, you know, discussing as a group what's being done for each population. So outreach, community engagement, or education methods being used to reach and serve the following ethnic racial groups in our county.
You know what, Chris, this is a lot of this is MHSA stuff, right? That I'm not familiar, I personally am not familiar with. So it just occurs to me that we don't have a section manager that's present that's responsible for
Right.
that stuff.
That's a good point.
How many questions are there like this about outreach and like?
Let's see. Let me scroll down. So 13 is outreach and engagement. 14. I think it looks like it's just number 13. Oh, are you asking how many questions are in question 13?
I guess related to what might be answered
By
in the
MHSA.
MHSA efforts, right?
Yeah.
So I don't know. So I'd have to, you know, I was so focused on the race and ethnicity data stuff that I actually didn't look at this.
Yeah, it looks
This
like a couple
piece
of
this question.
a couple of the questions would be relevant for MHSA. We could go through what we can today and then connect.
Maybe have Melissa come look at this stuff and come.
Well, we are on a deadline to submit this data. We did get an extension, but we're not going to be able to meet again. So I think Melissa will have to connect with the board outside of this meeting. Kathy, you're muted.
Let's just do our best on it, and then we'll have Melissa maybe just look at it. 13. And maybe Tori, you can, you see Melissa, right? She works close to you, Tori? No?
I think she works remotely most of the time.
Okay. But maybe we can ask her just to look at 13 specifically and
look at our responses.
Yeah.
Okay. So,
so let's just do the outreach at local and community venues and events first. So do we do this for American Indians? If you count the work that Indian Health does, I'm sure that that would be a yes. And they're funded by MHSA in part. So I think that that one can be checked. The rest of them is just a generality, but going specifically to to a group, I don't think we do it for Asian and Pacific Islanders. But the Honor Jackson's gets MHSA funding for probably the Black group, and the Hispanic group probably yes through Latino service providers. Do we do outreach at local community venues and events? Probably you could say yes for white, just because there's so many people in the county. And if you're being specific, I don't know about other and I don't know about other, whether you would check that one. Anybody think that more should be checked there?
Not by ethnicity necessarily. I think you're doing great, Kathy.
Well, I've been sitting in those meetings with Melissa, so hopefully I know a little bit.
Well, it shows.
I hope so. But I've been known to really blow it too. So, house visits. I haven't a clue on this one specifically.
Well, we have the outreach teams, we have post-hospital visits, we have, yeah, so it's hard to, house visits to underserved communities. I mean, this is outreach and engagement.
But doing it by ethnicity?
I think we would have to follow up with Melissa to see what
Mhm.
specifically
I
is
mean, I
being
would
done.
think the promotors for Latino service providers for sure.
Yeah, I think that that's probably, I think that there are house visits going on there.
Yeah. There's house visits for like the dad's program and those kinds of programs, but it's about young children. That's not specifically about ethnicity, right?
And there, yeah, there's no focus on ethnicity there. And especially with COVID, I probably it's not happening.
That's a good point.
Well,
isn't
oh, go ahead.
I was going to say again, but this doesn't break it down by ethnicity, but triple P is MHSA, or at least it used to be. I'm not sure currently, and that's home visits to do that intensive kind of education, but it's probably not. I don't know if we can get the data.
I think this is one that what number is it? 13. I think this is one that we could also comment that due to COVID, house visits were limited, and the programs that we know of were not, except for Latino services providers, were not specifically focused on ethnicity. And just put that in the comments. So I don't know whether that would be not applicable or just the one thing.
What else did you want in there, Kathy? Sorry, due to COVID, house.
I'm making notes too, but and not that they weren't broken down by ethnicity.
The next one is telehealth services to increase access and engagement,
Well, that definitely happened during COVID.
but broken down by ethnicity.
I bet it happened with everybody.
Mm-hmm. Is the board comfortable with marking yes for every ethnicity for telehealth?
I think so.
Yeah, I am.
I am.
Makes sense.
Okay. Community stakeholder meetings and events. It's probably going to be the same groups we talked about for the first one, where we know there's Latino service providers, there's we
Yeah.
can verify with MHSA coordinator, Community Baptist Church.
Yeah.
So it might be the same as the first one we did, Tori.
Yes, the Indian health
Mhm.
and white.
Yeah, so Native American, Black, Hispanic, and white. Yeah. Written materials translated into multiple languages.
I think we can say yes to Spanish. I don't know about other.
I'm not sure what the relevance would be to mark the white population. I suppose if there are multiple languages, Russian speakers, and so on, but it's since the predominant language in that population is English, it's not being translated.
Yeah, I would agree with that. And our threshold language is Spanish. So a lot of our forms and, beneficiary handbooks and all that is translated into Spanish. There are some forms where we have to include taglines, grievances, that's notice of adverse beneficiary determinations, but it's so limited. It makes sense to check Hispanic here only, in my opinion.
I'm good with that.
Yeah.
Okay. Live or virtual interpretation services. This is where I would turn to Sid and Wendy and Karen. I'm assuming that in the interpretive services were used live or virtual interpretation services.
Yeah, for sure. I mean, I know I sign off on a lot of invoices for interpretation services throughout our programs.
And would that be, can you scroll up a little bit, Tori? We have, I know for sure Spanish language, so Hispanic. I don't know what your thoughts are on the other ones. Native American, Asian, Pacific Islander.
It's just other. And we put down in number 27, that interpreter services were used as needed. Those services interpret just about every language, right? That you use.
Oh, yeah, we have responsibility to interpret every language.
It's available.
That's why we have multiple different services to choose from.
You wrote interrupter.
Which might also be the case.
Yeah.
Educational classes, workshops, or videos.
Well, if you what jumps to my mind is, Erica's like Path to Hope type stuff. But other than that, did we have a lot of classes or workshops or videos?
I think we'd have to verify with Melissa Ladresh.
We do triple P in Spanish and QPR.
Okay.
Providing food or drink at meetings and events.
I think that's a no because of COVID.
Providing reimbursement for stipends for involvement.
Not that I know of.
Yeah, I don't think so either.
And does the Promotoris program have anything? Does it stipend the participants?
Yeah, but they're providers, right? They're not clients necessarily, right? But they get paid,
Mhm.
you know, like peer provider kind of thing.
And it's not like, okay, you come and get help here and we'll give you $25 for Safeway. It's not that sort of a thing. So I don't think that there's a lot of that. It's hit and miss if it is. So
Mhm.
I'd say not applicable.
Providing transportation to and from services.
We do a little of that
Mhm.
with our transportation team, not much. And I couldn't tell you about any breakdowns.
Yeah. It would be available to anybody that needed transportation. It's not limited based on, I mean, obviously it's not limited based on race or ethnicity. So
So put other and we'll comment.
okay. Oh, look, there's an other box right there for that question.
Okay. Well,
Right.
I will send Tori my notes and between us we'll get that one filled in.
Okay, so number 14, which of the following groups are represented on your mental health board, commission, or related work groups or task forces? Select all that apply.
Okay, so I think it's just our mental health board that we're looking at.
Okay.
It says Black, not African American.
For a change.
Okay, yes for Black. Yes for Hispanic. Yes for white.
Yes, for older adults.
Yes for old ones.
And if we include the JC peer representative, Tay would be represented as well.
Yeah. Mhm.
Okay,
Yes, that one's good.
that was the easiest question so far.
Yes.
Number 15, which of the following steps have been taken to develop a culturally diverse behavioral health workforce in your county? Check all that apply.
Okay, you guys will do better on this one.
Mhm. Tailoring recruitment efforts to applicants who are representative of the racial ethnic populations in your county. I know we're working towards that, Susan. Would you say that we've done that?
No,
Utilizing behavioral health workforce pipeline programs that value cultural linguistic diversity among applicants.
no,
Actively cultivating a culturally inclusive workplace environment in which race, ethnic, minority staff are engaged.
no,
Providing professional development opportunities such as mentorship or continued education and training for behavioral health staff and providers.
no.
I skipped one.
Yeah, that one, no.
I skipped one. Conducting listening sessions. Okay. What have we done anything?
What else have we not done? I mean, all of this is coming up. I mean, right. I mean, if you look at this list, this is all the stuff that's on our plan, but for this period of time, we're not.
Yeah.
You know, we haven't done these things. Some of them we used to do, and they've kind of fallen by the wayside. So we're picking a lot of this stuff up.
Would it be worth mentioning in the other or in the comment box that that is part of the department's strategic plan or the divisions? You know, there are some elements.
Part of the counties. It's part of the county strategic plan, right? And so we have, and you know, we've hired we created a position for diversity and equity and inclusion. Right.
We have you, yes.
Right, manager who is working, and you know, we have a cultural competency committee, which is on pause because I just need to wrap my brain around it. So I would just say, I think I would say that it's part of a pillar for racial equity and social justice for our county, right, our board of supervisors. It's and that we have a designated position specifically to work on those issues in our department. And that, you know, more of this is forthcoming, you know.
So,
I'm working on something right now.
so why don't we check other there, and Susan, if you can type what you just said and email it to Tori.
Yeah.
So she can put it in there.
Yep.
Great. Okay, number 16, does your county provide cultural proficiency training for behavioral health staff and providers? If yes, describe. We've said no. Is that accurate?
No, we don't. We haven't.
Right. We haven't done that interpreter training in a long time, right?
We haven't done a lot of training in a long time.
Yeah.
Working on that too. It's all gonna
Okay.
come sort of flowing through at some point here.
So,
Just so the mental health board knows that there's, at some point I can talk to you about what our full plan is. It's not being ignored. We're moving forward on a lot of things.
So if there's something to add about what is in the plans,
I
can you
can add
email
that.
that to Tori? Great.
Mhm.
Okay, number 17, which of the following does your county have difficulty with in regard to providing culturally responsive and accessible mental health services? Select all that apply. And it looks like we select all. We selected all of them. Employing culturally diverse staff and providers, retaining culturally diverse staff and providers, translating written materials, providing live virtual interpretation services, providing cultural proficiency training for staff and providers, and outreach to racial ethnic minority communities.
Mhm.
Of all of those, translating into written materials is the one thing that we do.
We do.
And I'm sure there are challenges that go along with that.
Yeah, but yes, we do that.
All right.
Should that be unchecked? Or do you want to leave it as having difficulty?
I think we still have challenges with it. I mean, I know that sometimes it takes a really long time to get something done.
Yeah.
So should something be put in that comment box?
Not necessarily, because it is something that we're struggling with. Yeah. Okay, number 18, what barriers to accessing mental health services do individuals from underserved communities face in your county? Check all that apply. And all of these are checked. Language barriers, lack of culturally diverse representative staff, distrust of mental health services, community stigma, lack of information or awareness of services, difficulty securing transportation to or from services, difficulty accessing telehealth services.
I'd like to add one more, social isolation.
Mhm. Anything else to add from anyone else about barriers to accessing mental health? I'll check the chat. Nothing in the chat. Okay. Moving right along. 19, do you feel that the COVID-19 pandemic has increased behavioral health disparities for any of the following groups? Check all that apply. And it lists the different ethnicities, older adults, TAY, and also includes children under 16. Does the group have any
Chris,
input?
moving to the virtual format for appointments created some disparities for the older adult population particularly.
That makes sense.
I think that it was difficult for everybody. But nobody specifically. I mean, they should have an all of the above down there.
Or
They
we
don't have
just-
and they don't have a generic other, but you know, we have a lot of clients that don't have phones or, you know, they're
Or internet.
yeah, so it created barriers for them based on socioeconomic status.
And rural people who are isolated, you know, like under a tree.
Mhm.
There's a lot of them in this county.
Mhm.
Well, if we believe that it has affected all of these categories, I guess we could check all of them other than none of the above.
Any
Is was there any agreement on that or no?
Yeah, I think it's everybody.
Makes sense.
And I think you can say that just, I mean, you can really just say that across the board.
Yeah. Okay, the next question, please rate the impact of the use of telehealth services during COVID-19 for the following groups regarding access and utilization of behavioral health services. And the ratings range from very positive down to very negative for these ethnic groups. So rate the impact of the use of telehealth services during COVID for the following groups regarding access and utilization of behavioral health services.
It's like we would have had to have conducted a satisfaction survey to figure that out.
Yeah, I'm not sure how we can determine that
Yeah,
without a data set under it.
we're not tracking by race, or we don't have that data available right now.
Right.
But we can look at service utilization of telehealth by ethnicity and race, and compare it to previous years, but I don't know if that'll tell us that that's due to telehealth or not. I mean, there's other factors.
Yeah.
Right, that would only tell us who received telehealth. That's not telling us the impact of using telehealth on that population.
Yeah,
because
you couldn't.
And using telehealth might have a very negative impact. They're not having a face-to-face, person-to-person interaction.
I mean, we would probably have to compare the rates of access and engagement into services from pre-COVID times to access and engagement with telehealth services during COVID time.
I think so. So I think there's been positive. So there's COVID and then there's telehealth, right? And so, I mean, there's been some positive stuff around us utilizing telehealth. We have said for years and years and years, oh my God, we're never going to see anybody if we use telehealth. And we actually have seen for like families with small children or that kind of stuff. We've actually, so it's kind of an odd question because there's been some positive, for some people telehealth really works. So I just get a little nervous that we're kind of throwing the baby out with the bathwater because it's starting to sound like telehealth doesn't work for anybody, right? And so, but it does work for some, right? And so it's a both and that's I think the fault of a question. So I just want to be mindful about how I don't know what that means about how we answer it, but I think to me, I think it's all sort of somewhat positive and somewhat negative, right? For every group, because we don't know. I mean, and you ask two people from the same ethnic group and they're going to tell you, I think it's been great and amazing. And somebody's going to say, I think it sucked and it was terrible. So, and it's a weird way to ask the question, but I don't know. I just don't want us to all of a sudden to present this thing that telehealth, I mean, COVID really was bad. Telehealth, not, I mean, there was some positives.
So what if the boxes were checked as neutral? Since we aren't sure and we can explain, we can add a comment for number 20. And Kathy, we can, we'll put in what we talked about and put in our comments and responses and send it over to you to share with the board, and we can have a back and forth on the comments that we're sending.
Okay. But you probably have to send it in before I talk to the board. So,
while we're moving on to the next one, I'll check what we did get an extension to submit it. I'll check what that deadline is. Okay.
Because we're not meeting as a board again until January.
Oh, well, it's definitely before that.
That's what I thought.
But it could maybe, I don't know if we want to do through email or just, take a look and let me know if you have any comments or.
Yeah, we get the people who are on this Zoom can comment, but we get in trouble with the Brown Act. So
okay.
We'll do what we can, submit our comments. Tori can manipulate them. I'll talk back and forth with Tori, but yeah, we'll go from there.
Okay. There's a question in the chat. Do we have data for this telehealth pre-post pandemic? we have it available. It's just a matter of getting it.
Yeah, and we'd have to, evaluate and validate it. It's, there may have been some coding issues around phone versus telehealth because they're different things. And so there's going to be
That's
some
true.
user error in the data set
That's
around
true.
that.
Good point. Especially when COVID first started, there were some issues with how to code my time. And some people working from home would put home. All right. So the last question, which providers or services have been employed, utilized, or collaborated with to serve the following racial ethnic populations in your county? Select all that apply.
Okay, so Promotores was definitely Hispanic. Community health workers. Ugh. Goodness gracious. Okay, so let's go down on this one. In the first column, Native American. Okay, whoa, at the bottom, local, tribal, nations, native communities. Yeah, that's on Native Americans. That one could be checked. Community.
Aunties and Uncles program, what does that fall under?
What?
The Aunties and Uncles program?
That's what that would be.
I
Is
think
that same? Okay.
But community-based organizations, is Indian Health a community-based organization? Or is it a native community?
Well, it's
I think it's both.
it's specifically for Native folks, right?
I bet that we could call that a community-based organization as well.
Well, yeah, they have components of it.
Yes.
Yeah, not medically driven.
SUD providers
Through Indian Health.
through
There
Indian
are.
Health, yeah. Peer support specialists, that. Not by the definition of mental health peer support specialists, but if you Native are peers to each other, but
I'd probably say no to this one because they're probably referring to the definition of peer support specialists that we're trying to work towards getting.
community accepted first responders.
I don't know.
So yeah, I think that's probably no. And community health workers,
Probably at Indian Health.
that's probably a yes. Okay, so let's go to the next column. Pacific Islanders and Asians. I don't think we have any actual programs for them, do we?
I don't think so.
We don't.
Okay, so just there's
Skip
nothing
that.
there then.
Mhm.
Black.
Isn't there a program through MHSA?
For Asians,
Black,
for Blacks.
or something.
Well, for
Well, there's
the
community-
Baptist Church, yes.
Yes.
Community Baptist Church. Mhm.
So are they community health workers?
No, they
No.
are. that would be a community-based organization.
Mhm.
Yeah. So yeah, community-based organizations. They're not a tribe.
I think that's the only one would be a community-based organization.
Yeah, and we don't have anything specific for SUD for them, no, that I know of.
No.
Okay, and then Hispanic, definitely they've got the Promotores, the community accepted first responders. I don't think we have anything based on ethnicity there, do we?
That would be like, is that referring to the cahoots thingy?
I think, but it's not based on ethnicity. So SUD providers within the Hispanic community.
Are there Bilingual only SUD services.
Yes, they have specific services for people who are non-English speaking. Spanish speaking.
Community-based organizations, I would say yes.
Mhm.
With Latino services, and they're not tribal.
Okay.
Okay, and then white. Well, again, it's not based on ethnicity, but there are definitely community health workers out there. I don't know.
I would say it's probably yes to everything except the last one, because most of our services.
Yeah, they're English speaking white people.
Yeah.
Okay. Okay.
And I lied. That wasn't the last question.
Okay.
This is the last question. Which providers or services have been employed, utilized, or collaborated with to serve the following racial or ethnic populations in your county? Select all that apply. Wait. Yes. Which providers or services have been employed, utilized, or collaborated with to serve the following racial ethnic populations in your county?
So is this an extension of, I'm looking.
Yes, it's the second part of the question. It just didn't fit all on one page.
Okay, so we're going, should we go down again or should we go? I don't know, just go.
It might make more sense to go horizontally on each category.
Okay, so we can do that now. So homeless services, are there specific homeless services for American Indian?
I don't think so.
Pacific Islander, Black, Hispanic?
I don't think there's a specific homeless service for Hispanic. It's for anybody.
So just put other, I guess. I don't know. Or NA.
I mean, the actual question, which providers or services have been employed, utilized, or collaborated with to serve the following racial ethnic populations in your county?
Well, they serve anybody who is homeless, right?
Am I looking at the wrong? Can you scroll up a little bit, Tori? I'm sorry.
You're looking at
so
the right question, Chris.
It is just a continuation. Okay.
It is, yeah.
Never mind.
And they're just asking if we use these services with these groups, and the answer would be yes across the board for homeless services.
And then the same for K-12 schools. I mean, why would you say you're Asian, go away? No.
I think they're asking if we've collaborated with local K-12 schools.
Well, we are now with the counseling, and we did in the past. So I'd say yes. Have we collaborated with higher education institutions?
Yes,
I don't know
so
that we've done.
JC is.
Oh, that's right.
The peers program at the JC.
But I'm not sure if it is considered a higher education institution. It's part of the district. But we can say yes.
Yeah. The JC's higher education. Domestic violence programs.
No,
would
but
say.
we will.
Well, if we're viewing these questions, so the homeless services, the schools, higher education, they can reach any of these ethnicities is kind of how we're answering these. Our domestic violence programs like Verity, the Family Justice Center, they're open to and can serve anyone.
And we do refer quite frequently.
We do. And the Family Justice Center is pretty, I don't know what the word is I'm looking for. Amazing. Immigration services.
I don't think we actively do anything there, do we?
I don't think we do. Mm-mm. Sport athletic teams or organizations.
I'm not aware of doing that on the
I'm-
adult side.
I'm not aware. Grocery stores or
Place
food
to grow,
pantries.
Wendy, place to grow.
Mhm.
Yeah, I'll work on it.
I think that they're on their own. I don't think that we do anything with them, do we? No.
Okay. And then Tori will work on putting the suggestions we've talked about into, oh, I'm sorry, this is not the last question. Do you have suggestions for improving outreach to and or programs for underserved groups? Any suggestions?
Additional funding.
So we may need to look at some outreach to the Asian American population.
Anything else?
So this is a weird one, but on 21 in the comments, we do have that strange we do have that strange MHSA program, I forget the name of it, where they're training hairdressers to look for signs of depression. I forget the name of that one, but it was one of the ones we picked and got funded
Oh, for innovation, yeah, I don't know.
for
I'd have to-
innovation.
Mhm.
Yeah. If I think of it, I'll tell Tori. That's on 21.
Yes, I have the data set for access, if we want to go back and answer that question.
Sure.
Yeah.
Which question was that? What number?
It was in part 1, wasn't it? The initial data, we looked at?
No, it was question 12.
Okay.
Thank you, Wendy, for plugging away and finding that.
Mind if I share my screen? Okay. Here we go. Okay. So this is people actually accessing services as opposed to those that received later. So I put the Medi-Cal population statistic next to it so we can make a comparison. So for Latinx ethnicity, we're at 31.95% of the requests coming in identified that way, and versus the population of 42% overall. So we're actually slightly better on access than we are on engagement, but it's still not equal. So to my mind, at best, that would be fair. I
Yeah.
wouldn't put it at good.
Okay, so let's put fair there.
Okay. And then if we go by race, this is the population statistic, and then here's how we did. So we're under again on Asian Pacific Islander, not quite as under as on engagement. So we're losing people between access and engagement portion. So this is again at best fair. And we're actually pretty good on other. So, and we're and pretty good on Native American.
So good, fair, on Black. We are
Actually over by
Yeah.
a fair amount. So that's pretty good.
So pretty good, it's an on there.
Okay. I would put that at the very good level then.
Very good.
Wendy, a question is typically other something which is a self-identified category.
If the largest group in that category are folks who identify as Latinx ethnically, and then when asked to pick a racial category, say none of these fit me, I identify this way.
Thank you.
What was our decision on the white population? Was it very good, excellent? What was your choice?
Well, we're definitely overserving that, so we could say excellent on that category.
That was regarding the access.
These are the access numbers.
Okay.
All right, Tori, do you have what you need?
What about the other? We'll do very good on other.
Yeah.
Okay. And then what about the engagement?
Oh, we already did that.
Which one? Was that the top part?
This is the access. No, all of this is the access data. We already did the engagement numbers.
Okay.
The notes in 27.
Oh, I have the notes. Thank you. Sorry.
Mhm.
I knew that.
Okay. There you go. And then I reran the data set for residentials. I've emailed it to Sid and Chris. I can email it to Tori just to fill that in.
That would be great.
Okay.
All right, and I think the last questions are about who participated in this data notebook. I don't know if you want to share your screen. Can you share your screen again, Tori? The version that was sent out, it looks like the last questions were cut off. So. Okay. What process was used to complete this data notebook? I think we would choose a mental health board in partnered with county staff. Kathy, you're muted. Oh, and it was discussed at a board meeting.
Yes,
That one, yeah.
yes,
Are we also submitting to the Board of Supervisors?
yes.
Okay.
Yeah.
Does your board have designated staff to support your activities?
Yes, Tori.
Thank you,
Whatever
Tori.
Tori, yes.
Job,
Now,
job classification.
Was that really the last question now?
We need to put her job classification.
Oh,
I'll add that next.
Okay.
Yeah, and these are
we can
those are
fill this in.
fill in.
Yeah.
It's just us.
Yeah. Can you scroll down and see if I can't tell if there are any more questions, Tori? I think the
26
rest.
is the one where we write all that stuff in.
Perfect. Okay.
Yay. So anybody who was going to email stuff to Tori, do it. And I think that we've got it. So I don't know if I have to motion to adjourn, but I'm adjourning the meeting.
I appreciate everyone's collaborative efforts. So thanks so much.
Yes, thank you. And thank you, Bob and Michael and